This one muscle causes issues for your low back, shoulders and shoulder blades. And in this video we will tell you what this mysterious muscle is and, more importantly, how you can stretch it to make it nice and loose. Hi, my name is Teemu, I'm a physical therapist from Finland. Now if you dislike information, you can skip straight to the stretching techniques using the nifty timeline chapter feature, but we recommend that you watch the whole video. And this is not just for the YouTube stat boost. When you know how the muscle actually works, you know how to stretch it most effectively and you know what to avoid. And without further ado, here is the mysterious stranger. Not so mysterious anymore. It is called the latissimus dorsi, lats, the wings. A beloved child has many names. It's a big muscle, one of the biggest we got. It attaches to the thoracic and lumbar vertebrae and also to the sacrum via the thoracolumbar fascia. As you can see, it also attaches to the ilium and also to the ribs and also to the lower corner of the shoulder blade. And from there it grows straight to the shoulder and attaches to the humerus. This muscle is a proper workhorse. It's a multitasker, as you will soon find out. It internally rotates, adducts and extends the shoulder, and the most common exercise for this muscle is pull-ups. And from this information you are able to deduce that when this muscle is tight and stiff, your ability to lift up your arms is severely restricted. The muscle can also depress the shoulder blades and lock them down. This pulling down movement can make the neck and the shoulder area feel stiff and tight, and it can also compress the nerves near the neck, so you might get symptoms like pins and needles and numbness in the hands. Because this muscle has attachments to the ribs, the muscle can also contribute to forceful exhalation, so it's a coughing muscle. When the muscle contracts only on one side, it can contribute to rotational movements of the thorax. Now we move on to the lower back section of the muscle. So in this area, when the muscle contracts only on one side, it can produce side bending or rotation in the low back, but when it contracts on both sides, it can produce extension in the low back, or it can anteriorly tilt the pelvis. Because of these functions, tightness in the muscle can alter the movement of your lower back and your upper back, which can cause stiffness and pain. You might also feel this annoying stiffness when you try to stretch out your sides. Also, your lower back might look like Donald Duck's, so you have lots and lots of anterior pelvic tilt. Last but not least, because the muscle has attachments to the thoracolumbar fascia, it can provide stability to the SI joint, for example, when you are running. At least in theory, when the lats do not work properly, they can cause issues with the SI joint's ability to lock, or they might alter the joint's mobility. Good job listening to the whole theory section, champ. You are the MVP of the channel. Now that you are armed with the knowledge of how the muscle works, you can do the exact reverse movements to stretch the muscle with pinpoint accuracy and without compensation. Do not do the following if you have any injuries near the muscle, if you have any wounds near the muscle, or if you have any other reason why you should not stretch it. This is the first version of the exercise. So while standing, take a stick into your hands, palms facing up and thumbs pointing outside. Throughout the movement, always keep your elbows close together. Your wrists should be further apart from each other than the elbows are, like this. Next, we will go against the wall so that we can place the muscle into a stretch position. Like you remember, the muscle extends the low back. So naturally, we will flex the low back to get it stretched. So round out your low back against the wall like this. Now that the preparations are done, let's start the exercise by lifting up the arms. Do this dynamically for 1 to 2 minutes, 4 to 7 times in a week for best results. Remember to move without pain. Stretching is okay, but do not force the movement. Also remember to keep the low back glute to the wall, and remember to keep your elbows closer to each other than the wrists are, so wrists are wider than your elbows. Do not let your elbows flare out like this. This will destroy the stretching technique. While Marcus is setting up the next version of the exercise, remember to like and subscribe the video, especially subscribe if you haven't done so already. But this is the second version that is done on the floor. We will also show you how to use a rubber band or a belt to assist with the elbow positioning. You can also use this rubber band set up with the first version of the exercise. So you do this by lying on your back with your feet on the chair or something like we show here. Hips are in approximately 90-degree angle. This helps to keep the low back glued to the floor, maintaining the stretch position, pre-stretched position of the lats. So glue your low back to the floor. You can place the rubber band around your elbows like shown here. This will help you keep the elbows close together. Remember that the hands need to be further apart from each other than the elbows are from each other. Remember to place the rubber band on the forearm side of your elbow so that you don't hit yourself on the face with the rubber band when doing the stretch. After this setup, you just repeat the same movement we showed before, so bring your hands above your head and try to reach the floor. Only move as far as you can, remember not to overstretch, no pain should be felt, just a comfortable stretch. As an added tip, you can also just keep the hands in the up position near the floor like this and try to slide the hands further like this. But this is only if your mobility is already somewhat good. You can do this movement dynamically, or you can do the previous movement, so come off from the stretch and into the stretch dynamically like this. So depending on your mobility, as before, do this stretch 1 to 2 minutes and 4 to 7 times per week. And also we want to over deliver with our content, so here's one more bonus tip for the stretch. Like you remember, the muscle is also part of exhalation, so when you are in this stretched position, you can also stay here and take a deep breath in to make the stretch even stronger. Start to do this awesome stretch consistently to get the best results. Also comment down below what you thought about the stretches and also what you would like to see us do next. Now we are done. See you on our other videos. Bye bye!